Hi, I'm Art Kaplan. I'm at the Division of Medical Ethics at NYU's Grossman School of Medicine, where I'm the director. Well, it's flu season yet again. For many parts of the country, we're already in the thick of it, and for other places, we're going to have flu outbreaks continuing and intensifying. I've long believed that every healthcare institution, nursing homes, hospitals, clinics, places that are home care, hospice, should require flu shots for all doctors and all nurses because it is the easiest, cheapest, and most ethical way to protect the workforce from flu, who you need to be in there when flu outbreaks take place, and to protect patients against getting the flu when they come into hospital settings and get exposed to healthcare workers who may have the flu already but don't know it. In a recent Medscape poll, I was happy to see that the majority of physicians surveyed agreed with me. 65% said they supported mandatory flu vaccination in hospitals, and only 23% said they did not. I think flu vaccination is something that has already been shown to be useful and important, not only in stopping people from getting the flu, but in making sure that they don't get as sick when they get the flu. Just like COVID vaccination, that doesn't always prevent somebody from getting COVID, but if you get it, it keeps you from winding up at home sick, or worse, from dying and winding up in the morgue. Flu kills many, many people every year. We don't want that to happen. And a flu vaccine will really help prevent deaths, will really help prevent the amount of symptoms that somebody gets, will get people back to work. The benefits are pretty clear. Does the flu vaccine work equally well in every year? It does not. Some years, the strains that are picked for the vaccine don't match the ones that circulate, and we don't get as much protection as we hope for. But I think the safety side is so strong that it's worth making the investment. It's worth making the effort to promote mandatory flu vaccination. Can you opt out on religious grounds? Well, some hospitals permit that. At NYU, you have to sort of go before a committee and make a case that your exemption on religious grounds is based on an authentic set of beliefs, one that are deeply held, not just something you thought up the day before flu vaccine requirements went into effect. But there may be room for some exemptions, obviously for health reasons. If people think that the flu vaccine is dangerous to them and can get a physician to agree and sign off that they are not appropriate to vaccinate, okay. On the other hand, if you're working around especially vulnerable population, newborns, people who are immunosuppressed, then I think you've got to be vaccinated, and you shouldn't be working around people who are at huge risk of getting the flu if you refuse to be vaccinated, or for that matter, can't be vaccinated. Would I extend these mandates? Yes, I would. I'd extend them to COVID vaccination, to measles vaccination. I think physicians and nurses should be good role models. They should vaccinate. We know that the best evidence that's out there says that vaccination for infectious disease is safe. It is really the best thing we can do to combat a variety of diseases, such as the flu, such as COVID. It seems to me that in addition, the data that's out there in terms of risks in places like nursing homes from flu and COVID deaths is overwhelming about the importance of trying to get staff vaccinated so they don't bring flu into a institutionalized population. Similarly, for prison health and many other settings where people are kept close together and staff may actually move from place to place, rotating from institution to institution, spreading infectious disease. So I'm going to go with the Medscape poll. Let's keep pushing for healthcare workers to do the right thing, to be good role models. Let's get everybody a flu vaccination. Let's extend it to a COVID vaccination and its boosters. Let's try and show the nation that healthcare is going to be guided by good science, by a duty to one's own health and a duty to one's patients. And it shouldn't be political. It should be based on what works best for the interests of providers and those they care for. I'm Art Kaplan at the NYU Grossman School of Medicine. Thanks for watching.